This month of October has seen many traumatic incidences which has left many families in grief. From the deaths of children who died from ingested a pesticide, organophosphate, to the mass shooting incidents that occurred in several provinces. Health experts say such traumatic incidents very often lead to family members suffering from post-traumatic stress disorder.
I think for the parents themselves, they need the time to be given a chance to understand and make sense of everything that's happened. It's going to take a while. There is no doubt in my mind that this is not going to be a lateral process of grief or healing. But we as a community, as stakeholders in healthcare, mental health, need to ensure that we have the right support structures on hand.
Govender says many public healthcare facilities across the country are in most instances not adequately equipped to properly treat patients suffering from PTSD, and that in many cases it is wrongly diagnosed.
Most of our healthcare centers, be it primary healthcare facilities and hospitals, should ideally have mental health practitioners, be it psychologists or psych coaches, wellness coaches. Unfortunately, that is not the reality that we're living in right now. And the numbers in terms of our population dynamics to the access health practitioners is not always viable. We've seen that disjoint in many disasters that have occurred around the country, where we've had to appeal out to private and other public facilities to say, please release whoever you have that can assist to come through, so that people do not feel that their hurt, their pain, their trauma hasn't made an impact enough to be heard. I think right now, as much as we have people on the ground, the numbers are actually quite disturbing.
The South African Institute of Environmental Health concedes that it has not been proactive in their quality assurance inspections of large retailers and spaza shops.
Our environmental health practitioners throughout the country, they are doing a lot with the limited resources. It's just that we are being outnumbered by the mushrooming of these shops. Currently, we have got less EHPs in the country, but we are doing a lot. And when we say we're not doing enough, one cannot say so, because whenever we conduct inspections after the incident, it's then that we will mobilize other EHPs from other areas so that we can go in good numbers.
Meanwhile, the South African Depression and Anxiety Group, SADC, says the number of calls it receives on a daily basis has been increasing and has advised families that are going through trauma to seek help as soon as possible.
We get over 3,000 calls a day at SADC on all our toll-free helplines and SMS WhatsApp helplines. From there, I can't exactly tell you how many of these traumatic experiences we do get on a daily basis, but I would say it's a lot. People go through so much in South Africa. It might not be trauma because of the loss of a loved one, but it could be trauma just being exposed to something that is traumatic. So we see people will witness the death, or people are passing by and they see something happen to someone. Their types of trauma are very prevalent.
Parents and families can use the NGO's toll-free landlines and WhatsApp for free counseling. For SABC News, I'm Kwazulu-Natal, Johannesburg.